Okay, and this is again today's talk. We're going to be doing a little something on Colorado's experience with their cannabis legalization. And I think we've had a talk a while back. It was maybe a year or two ago, and interested to see where this has gone. So next slide, please. All right, we have a lot of different talks coming up over the next month or two, and we're really full up until into August, and so we have a lot of great talks coming. So please keep showing up. It makes it much more fun for us if there's a nice big crowd, and I think for some of the speakers as well. Next slide. Remember the free CME, you all know about that by now, but just make sure you send that back to Katie so you get your free credits. And again, just feel free to fill that out. And if you do not get the credits for watching it on recording. So just keep that in mind. Next slide. And if you have any questions, we're always happy to answer those. You can call either Heather, myself, or Aaron, who just popped up. If you have any questions about patients and you need some help, we're always happy to help you. Those are our cell phone numbers, which I think almost everybody in the state knows now because we have calls from just about everywhere. So don't be afraid to call if there's concerns. Next slide. And remember, you can go on the CORE website. All of the things that we have produced are given away free, so that you can find just about anything there, including the manual, lots of protocols, all kinds of stuff that have been made during the year. So next slide. All right, so we will let Richard, if you wanted to kind of introduce yourself, kind of tell us a little bit about what you do, and we'll kind of go from there. And again, thank you so much for coming. This is a talk I think that'll be pretty interesting for all of us. So thanks again.
All right. Yeah, good afternoon, everybody. My name is Richard Holdman. I am the project manager and medical consult for the marijuana health monitoring team under the Cannabis Sciences program at the Colorado Department of Public Health and Environment. So let me share my screen. I always forget the order I have to do this in. Start presenting and then share, I think.
Yeah, don't ask me, but Katie can always help. I'm pretty much useless when it comes to that. So.
All right, I think that did it. Can everybody see the intro slide?
Yes.
Perfect.
And if everybody would, again, if people would like to turn on their videos, we'd love to see people's faces. I forgot to say that at the end. So thanks for popping some on so that it's not just all black boxes. Okay, thanks again, Richard. So go ahead.
Yeah, thank you so much. So just to give a little preface, this is focusing on public health and marijuana in the state of Colorado, essentially what we've learned since we legalized back in 2012. So just some objectives for this presentation. I will provide a short overview of how we monitor marijuana use and health effects in the state of Colorado. I'll also describe the cannabis use trends that we have seen in the state of Colorado since legalization, and this will involve different populations as well. And then by the end of this, you will be able to understand how we utilize surveillance data and literature reviews to inform prevention and/or education efforts throughout the state. So written in law, when Colorado legalized in 2012, part of the law wrote basically to our department that we need to monitor changes in drug use patterns broken down by county and race and ethnicity, and the emerging science and medical information relevant to the health effects associated with marijuana use. So based on just this sentence, we developed our marijuana health monitoring and research program here in the state of Colorado. And so this essentially is split up into two realms. We have our patterns of marijuana use, which is done through surveillance of public health data. This includes various surveys and then health incident databases coming from our poison center or our hospital data. And then our other component is our emerging science and medical information. And this basically is covered by our Retail Marijuana Public Health Advisory Committee, which is essentially my main role here at CDPHE. I oversee this panel of scientists and healthcare professionals that were appointed by our director here at the State Department of Health. And they all have to have expertise in some realm in health. We also have a representative from the Poison Center, and then various aspects of health, like we have pediatricians on our board, and then emergency department physicians are definitely represented as well. And basically, this committee, we do a ongoing systematic literature review to develop our evidence statements about potential health outcomes related to marijuana use. And since it was basically written into rule that we're just looking at the negative health consequences, we do not currently have statements about the benefits or positive uses of marijuana. So this is specifically monitoring those health effects, specifically the negative ones that we want to protect our population from. So here's a little bit more about this advisory committee. Like I said, we systematically review current scientific literature and public health surveillance data together to try and inform our efforts throughout the state. So the main job of this advisory committee is to develop these evidence and public health statements. These are written in a way that will convey the evidence that's available in scientific research. As I'm sure many of you probably do know, that marijuana research is pretty limited at this time, especially, I mean, we're using studies from the 90s still for some of our evidence statements. So it's definitely a big push to, for our committee, is basically to identify these gaps and provide recommendations as well. So after we develop these evidence and public health statements, these are then utilized by another department within the State Department of Health. They take our information and they put those into the public health related policies and surveillance activities. As I said, we also identify research gaps, and we play a pretty big role in the Institute of Cannabis Research here in Colorado, just trying to influence the studies that do get approved and funded to be things that we have identified, which I will definitely touch on multiple times in this presentation. And then the main thing that this committee does produce is a biennial report that goes to our Colorado State Board of Health, the Department of Revenue, and then the General Assembly. So this is informing those policymakers and others just about what's going on throughout the state, especially regarding the data and any new findings in the science related to these health effects. And I also would like to state that our report started back in 2012 as a giant paper report, and now we have transitioned to having infographics for this. So we found essentially that people just weren't reading our report. Information wasn't translating well. So we have developed this infographic format basically to show all the evidence at once, and hopefully people can get a better picture of the science at the time. All right, so now I'll go into briefly our surveillance data. So these are our sources that we currently collect. These are constantly changing. We're always evaluating if these are worth paying for, worth collecting. And of course, if there's any new sources out there, we're always looking for that as well, just to see how our citizens are using marijuana throughout the state. So our main one is at the top here on adults 18 and plus is our behavioral risk factor surveillance survey. And this basically is looking at Colorado adults, how they're using, how often they're using, how they're using. So are they smoking, eating, vaping, other things like that. And then we have our Healthy Kids Colorado survey. This is for youth in 6th through 12th grade. Very similar to the adult survey, just looking at who is using, how they're using, how often. And then for children, we also have questions about perceptions of use. So that's something that we found very important early on, was just to monitor how teenagers view marijuana, especially as our campaigns have been released throughout the state. And then our third one is our pregnancy risk factor surveillance system. So this is looking at anyone in Colorado that is a new mother, 16 or older, and it's looking at prevalence of cannabis use throughout pregnancy. So this includes before and after pregnancy and during breastfeeding as well. And then we have our child health survey. So this is children 1 to 14 years old. And this is all involving safe storage of cannabis and use in the homes when children are present. This is especially important if people have noticed the recent attention, basically, that edible products have gotten that are sending kids to the ER, just unintentional exposures. So this is our survey to measure how that's happening in the state. And then down below, on the bottom of this slide, we have our two data sources, one of which is the Colorado Hospital Association, and then our Poison Center as well. So this gives us those exposures, adverse exposures that people might be reporting to Poison Center or showing up to hospitals affected by marijuana use. All right, so here are our most recent findings from our adult marijuana use survey. So I believe this is 2021, our 2022 data will be coming out this summer. So we're kind of always staggered a year behind like this. But our 2021 data showed that 19% of Colorado adults report consuming marijuana within the past month. And this still remains higher than national estimates and has been that way since legalization. The current national survey on drug use and health in 2020 had the national rate at 12.2%. So, pretty significantly lower than our 19%. And we also identified through the survey that the population with the highest use is those adults that are 18 to 34 years old, males, and those that I identify as LGB. So the second data point on this slide is that 3.3% of Colorado adults report driving after marijuana use. And this is always something we want to monitor, especially with regard what we've learned from alcohol over the years of just how severe it can affect driving. And we want to stay on top of the marijuana use and driving within the state, especially since this research is pretty limited on this. We don't have a way to detect acute marijuana use, especially when compared to chronic users that have THC levels in their blood at all times. So there, unfortunately, is not a very good method for measuring this, but we do like to obviously keep the data. And these are all surveys, by the way. So these are self-reports from these adults of admitting that they drive after use. And then it's important to note that this trend has remained stable since legalization and commercialization once the stores opened in 2014. All right, and then, so the last two data points on this slide are specifically about adult consumers. So this is just that 19% from the first data point. So of that 19%, 52.3% report using marijuana daily or near daily, which obviously this leads to a lot of health concerns, as a majority of our public health statements are about daily or near daily users. Those are the most at-risk consumers. And we like to compare, especially with data, those to binge drinking or cigarette use, which I'll show on the next slide. And then just to compare, this weekly use is about 25.9% and monthly is about 21.8%. So, over half are using daily or near daily. All right. And for the last data point on this slide, this is looking at method of use. So we ask people how they're using, and this is a select all survey question, and smoking does remain the most prevalent method of use among adult consumers. You can see down below, though, that smoking has dropped a little bit from 82.9% in 2014 to 71.5% in 2021. And where we estimate that that's left basically is now more people are eating or drinking marijuana products. And that has increased from 35.6% to 46.8% in 2021. So this is something we like to track, especially with regard to those unintentional child exposures, since they pretty much always involve edible products. So this is basically leads us into how we can focus our prevention efforts in that realm. And then I do want to also state that vaporizing has surprisingly decreased in recent years. It went from 32% to 27%. And opposite that, dabbing marijuana has increased from 17% to 20%. So not as high as smoking, but as these products become more available, more people are using them. So here is our graph showing, so this is percentage of past 30-day substance use among Colorado adults, 2014 to 2021. You can see daily or near daily marijuana use is in the green line at the bottom. You can see that kind of slow increase from 6% when we started collecting data to the 10% we see now. And you can see that this is lower than Colorado adults that are binge drinking alcohol or smoking cigarettes in the past 30 days. However, you can see that it is approaching and probably will overtake cigarette smoking with time. All right. So moving on to our data involving youth marijuana use. Our most recent year, 2021, showed that 13.3% of Colorado youth admitted to using marijuana within the past month. And this is the first time we've actually seen a decrease. So it was remaining pretty steady, which you'll see on the graph on the next slide, since 2013 when we started collecting this data. So this is the first decrease we've seen, and there's lots of theories around, especially with COVID, people being at home, maybe not having as much access. So we're very excited to see, basically, will this trend continue? Will it bounce back up to where it was pre-COVID years? Either way, we'll be definitely hoping to publish some papers on our theories and statistical analysis on that in the coming years. So just like our adult use, we also like to look at driving after marijuana use. And this, again, this decreased. So this is specifically, though, among youth that drive, decreased from 11.2% in 2019 to 5.5% in 2021. Again, probably some implications of COVID, being locked in, maybe not having to drive to school or drive to a friend's house, things like that. But we'll see how that trend continues. All right, and then the unique thing about the youth survey is that we look at perceptions of marijuana use, and to me, it was pretty surprising the first time seeing this. 60.4% of youth think regular marijuana use is risky. And this has increased from 50.1% in 2019. So I think this definitely leads to some evidence that hopefully our prevention campaigns have been working, educating the youth. We also know that youth are very active online. They read a lot about marijuana use. So I was quite surprised to see this many think it's risky, as the online basically environment seems to diminish the risk of marijuana a lot of the times. So this is definitely a nice data finding that we have seen. And then the last data point on this slide, again, is regarding method of use. And this is particularly concerning as 59.2% of those current marijuana users of the Colorado youth said they used THC concentrates, hash oil, or waxes in the past month. So this is particularly of concerning. We recently had a few new evidence statements that have come out regarding the concentration of THC and how it has it's associated with continued marijuana use in this population. And it's also associated with developing future mental health symptoms or disorders. So this is definitely a data point we're going to watch closely and something we can target our prevention efforts on as these products carry the most risk. And clearly a lot of the Colorado youth are consuming marijuana this way. And I do just want to take this time to say that while 59.2% admitted to using this, just like in adults, smoking remains the highest method of use, with almost 80% admitting to smoking in the past month. And then dabbing comes in second, followed by vaporizing, and then eating edible products. All right, so here is the data slide to show that basically how marijuana use has remained pretty stable from 2013 to 2019, hovering around that 20%. And then we see this decrease down to 13% in 2021. And I will point out, and I'm sure everybody noticed, that every other substance also experienced a drop from that time period. So that increases our support for our theory about why that dropped. But again, we'll keep monitoring this and see how it changes in the years. But you can see marijuana is the green line, kind of in the middle of the graph, with vaping, tobacco products, and alcohol use above marijuana use. And then cigarettes are definitely much, much lower than any of the other three. And then I'd also like to point out in this box I included on this graph, we do have a small section of this survey does include middle school students, and their use in the past 30 days is 3% currently, and it has remained pretty stable since 2013 once data collection begun. And while it was 6.3% at the time, it is not statistically significant decrease. So the number has decreased, but it's not significant as far as statistical analysis goes. All right, moving on to our third data source. This is specifically regarding maternal and child health. So this survey asks throughout all time periods of pregnancy, throughout the entire perinatal period, from before pregnancy, each trimester, and then after, and breastfeeding as well. So marijuana use during or after pregnancy has remained unchanged since legalization. Use before pregnancy, however, has been increased, and it's shown a pretty stable trend since legalization that you'll see on the next slide. So of these new mothers, 6.8% report using marijuana during pregnancy. So this has decreased from the 8.2% in 2019. However, it is still higher than it was when data collection began in 2014 at 5.7%. However, in some slight good news, marijuana use does remain less prevalent than alcohol use during pregnancy. However, it is more prevalent than e-cigarette use or cigarette use. And then another important data point that I like to point out is we do differentiate between the trimesters. And you can see here that as the trimesters go on, use decreases. So that has quite a lot of implications regarding health outcomes related to marijuana use, especially as as it relates to the infant. We do have substantial evidence from research that marijuana use is associated with small for gestational age babies. And we also currently have moderate evidence that these infants, once they grow up and attend school, they'll have decreased academic ability and cognitive function in exposed offspring. So we really do like to monitor marijuana use during these trimesters and see how that impacts the infant once it's born. And I do want to point out these first trimester and third trimester data points have remained stable since data collection begun. All right, so here is the corresponding data slide for this. This is showing in the green line up top, this is the before pregnancy use, which is obviously okay, as mothers that are 21 years or older are allowed to use marijuana before they're pregnant. Obviously, there's technically no law even stating they can't use it during pregnancy. But obviously, with the health outcomes and implications like that, we're trying to educate our population to at least reduce risk in that realm if possible. And then you can see at the bottom of this graph, we have the postpartum and currently breastfeeding in orange, which has remained the lowest over time and has seen no increase or decrease since data collection begun. I also do just want to take this time to point out that we are currently developing our new provider guidance for pregnancy and breastfeeding, basically for clinicians throughout the state, how to talk to patients, what the actual laws are in the state of Colorado. A lot of patients don't want to admit that they're using marijuana as they're scared their child is going to be taken away or they're going to be put in protective services or things like that. So we're trying to educate our providers so patients will be more open at admitting about their marijuana use, as there are a lot of different reasons that women use. We've learned through surveys, just a lot of them are using it for morning sickness to relieve that during first trimester or other symptoms as they go throughout pregnancy. And if these women think it's basically less risk than prescription medications or over the counters, they're going to continue using. So it's very important to have our providers have this conversation and learn why these patients are using, so we can hopefully change this trend and reduce the health outcomes for infants. All right, so this slide is regarding our Colorado hospital data. So we collect two forms of this. We collect data from ED discharges, so the emergency department. This includes any patients that are not admitted to the hospital. They might get discharged from the ED or get admitted depending on where their path goes. And then we also collect the data on hospital discharges as well. So this is specifically using ICD-10 billing codes. There are two essentially groups. We have marijuana use, abuse, and dependence. So that's essentially for those older users. And then we have our marijuana poisoning codes, which are for those basically unintentional exposures among children. So for our ED discharges with any marijuana-related billing code, we have seen a decrease over the last year to the lowest rate since retail legalization. And I did include the numbers here in the small text just to show how much it has decreased since then. And then specifically, one of the we've identified just this population of concern is these children under 6 years of age exposed to marijuana, and they receive marijuana poisoning codes, as obviously they are not intentionally using marijuana and definitely not of the legal age to use it. So unfortunately, we have seen ED discharges with these poisoning codes, specifically in children under 6 years of age, has significantly increased since legalization. And you can see the numbers here underneath, from 10.9 per 100,000 in 2014 to 75.9 per 100,000 in 2021. So pretty big increase, definitely one of our major areas of concern here. So moving over to hospital discharges. Again, with any marijuana-related billing code, these have decreased to the lowest rate since 2016, but still remain higher than the rate at legalization. So I've included those numbers underneath here to show we saw an increase at first, but now we've started to see a dip back down, hoping to get it back down to that rate at legalization or lower if possible. And then again, this last data point, pulling out specifically those children under the age of 6 years, hospital discharges with them has significantly increased since legalization. And this is the largest group that's affected by this. So definitely somewhere to focus all our prevention and education campaigns for any marijuana users in the state, just to reduce those unintentional exposures among kids. All right, and this is our data slide coming from our Poison and Drug Center. So our Rocky Mountain Poison and Drug Safety Center, these are specifically just calls. So this is just a raw number. This isn't a prevalence rate or anything like that, showing the annual frequency of marijuana exposures reported to the Poison and Drug Center. So these can be self-reports or parents calling, or anybody within the home can call, but most of them are calls from health providers at hospitals or urgent care centers, just reporting these exposures to the Poison Center. We also separate it. You can see with the lighter teal color is marijuana only, and then the darker color at the bottom of the graph is marijuana plus another exposure. And you can see that the increase that we've seen is related to those specifically marijuana only encounters. And we did include a few points here. So the medical market opening in 2010, we saw the first large increase from 44 to 89 reported cases. And then once the retail market opened for those recreational stores, we saw that massive increase from 125 to 218 from 2013 to 2014. And then relatively stable since then, but still trending upwards. And then at the top of this slide, just picking out the few important populations affected by this, you can see that 48.7% of reported exposures in 2021 were 5 years old and younger. 56.5% involved edible products, and 57.7% are unintentional. So those can be adults as well, just people that did not know that they were consuming a marijuana product. And then I do want to point out too, at the top of this slide, in 2021, they did receive 34,000 human exposures, and 310 of them were marijuana. So it's still a pretty low number when compared to other substances that get reported to the Poison Center. All right, so basically, how does all this lead to our prevention and education efforts? So this is, again, we're kind of circling back to what I stated at the beginning. We have our Retail Marijuana Public Health Advisory Committee. I will include a link to our website on the chat once I'm done presenting, as I highly recommend people go look at our public health statements, evidence statements. It's very comprehensive, involving many different areas of medical research, basically anything that marijuana impacts, even including some domestic violence statements. So what happens is these evidence statements are formed. They are translated through a systematic way to public health statements, which are then given to our prevention services division to come up with our evidence-based prevention and education campaigns. And these have been in effect once retail marijuana was legalized, and up until COVID, which unfortunately then budget cuts got rid of all of these in the state of Colorado, which definitely was a big issue at first, but has now kind of helped us focus on exactly what populations need the education and prevention efforts the most. So just to show the public health impact, through our data surveillance and scientific review, we have this continual dissemination of our reports through our websites and presentations like this one. And we also collaborate with lots of different stakeholders to continuously try to monitor those populations of need, what research needs to be done, and what resources essentially need to be produced and are desired throughout the state of Colorado. All right, so here is basically our evidence-based strategies. Most of this initially was from experience from tobacco and alcohol. So, once the law was passed, all right, now we got to set up the rules and regulations. So we basically followed those evidence-based campaigns that, especially with tobacco, saw a lot of promise, especially with the youth using tobacco products. So we put in a strict age limit, 21 and up. We limit the hours of operation, so that way it's not as accessible to youth, and we also have a high tax rate. So a lot of states differ on this. And so the high tax rate, you want to increase the price enough to deter youth from buying, but you don't want to drive the legal using adults back to the black market. You want to keep them on the regulated legal market so we can at least monitor health concerns and things like that, without pushing people back to the illicit market where we have no rules and regulations over that. We also have a lot of rules regarding packaging, especially regarding edibles. These cannot have any cartoons. You can't have pictures of fruit or animals, people, things like that. You just basically, you do not want to advertise these products so they're appealing to children. And if you ever see, we see it all the time, we get reports of like Nerds ropes or other candies that are actual commercial products, but they have THC in them. Those are never the legal produced products. Obviously those companies would not want us using their copyrighted material. So if you see that stuff, it's not a legally regulated product. We also, something that was unfortunately had to be learned within the first few years, was putting the limit on how strong these edible products can be. So at first there wasn't a limit, basically. So the industry for the first, I think it might have been just the first year, went a little wild producing these edibles that had, up to 1,000 or more milligrams of THC. And so that was obviously related to a lot of health concerns. You have novice users consuming too much and ending up in the ER with panic attacks. And then, of course, that just having more milligrams increases the risk when those children unintentionally eat these products. That is greatly increases the medical attention they need as the milligrams of THC increase. So the state implemented a rule that edible products have to have a maximum of 100 milligrams per package, and each package has to be divided up into 10 milligram pieces, which is still a little concerning, as the science has recently shown that, especially for those cannabis tourists, as you might want to call them, come to our state if they haven't used it before, 10 milligrams is a little too much for these people. So we have seen a few other states that have followed us implement lower limits of that, such as 5 milligram pieces. to try and help reduce people consuming a little too much when they don't know exactly what they're doing. Another thing that we implemented was use policies. So smoke-free housing, you can't smoke in parks, cars, schools, very much similar to tobacco. Basically, you can't do it outside anywhere that you're exposing it to members of the public. We currently don't have marijuana use facilities where people can go and smoke in public. They are, I think, on the rules to be coming soon, but obviously it has a lot of concerns, especially regarding DUIs and how you can measure those and protect people from going to one of these clubs, consuming, and then driving home and endangering other people on the road. Something else that was established with the rule back when legalization happened was the construction of our marijuana enforcement division. So they are housed under our Department of Revenue. So they take a lot more of a legal point of view for marijuana. So they're the ones that are ensuring the proper licensing of dispensaries, making sure that dispensaries are sending their products to be tested as the rules state. And they also monitor those manufacturers as well that are selling to these dispensaries, just making sure that all the grow facilities are following proper rules to protect our consumers, using the right pesticides that are approved when they're producing these vape products, making sure they're not using solvents that have shown to be associated with lung injury, like our vaping outbreak right before COVID happened. We actually saw that having our legal market basically prevented a lot of cases of the EVALI, the e-cigarette or vaping associated lung injury, as most people in the state of Colorado were consuming vape products that didn't have what was found to be the problem, vitamin E acetate, which was basically being used by those illicit companies to basically make a cheaper vape product. So having our regulations protected our consumers during that outbreak. And then arguably two of the most important things that have come from this information, once our statements get sent to the Prevention Services Division, they have developed these marijuana campaigns. So the first one that came out was right when we legalized. It was called the Good to Know campaign. And it essentially was just all about telling legal age citizens, so 21 and up, what the rules and regulations were around marijuana use. So, don't consume it out in public. Don't drive after consuming marijuana. Don't take it out of the state. Don't drive to Kansas where it's still illegal. Consume it in the state and don't travel with it. Things like that. So that was our first campaign. We learned a lot from that one, which led to our Responsibility Grows Here campaign, which focused a lot more on the those problem groups. So specifically youth. How do you talk to youth about marijuana use? And what we've learned is that you have to utilize a trusted adult. So anyone that these youth look up to, so it might be a coach, a teacher, their parents, whatever it might be, and to share information on the impacts that we know about underage marijuana use, that it does affect their memory and learning ability. It could have effects on their respiratory health as they age. Acute effects of use, so being stoned and then you can't study as well, you can't drive your car, things like that. We really wanted to focus on that because we know youth these days, especially, they go on the internet, they can find any information they want. So if you use scare tactics, we found it did not work at all. It just pushed them away and almost increased use, unfortunately. So thankfully, the Responsibility Grows Here campaign, we did see a lot of success through that, and is still active because the funding got cut and we haven't been able to do our new campaign, which would basically utilize what we've learned from both of these to focus even more on those problematic populations, like mothers using during pregnancy and the unintentional exposures among kids at home as well. So thankfully, we are starting to see some budget changes, and our prevention services is getting some money again. So we will be this year and next year partnering them a lot with using our research and data to focus these efforts and come out with our next campaign. All right, and then this is one last thing that we learned, which was not actually implemented until 2022. So last January, we implemented our adverse health event response. So we collaborated with the Marijuana Enforcement Division to basically have a systematic way to receive complaints throughout the state after people have consumed a legal product and they either had health symptoms, thought there was something wrong with the product, anything like that, they can report it. Information gets sent to us at the State Department of Health. We will contact the people, see what they experienced. Did they have any signs and symptoms? Did they seek medical attention? What happened after they consumed this marijuana product. At the same time, the Marijuana Enforcement Division is using their resources to look up and make sure that this product had passed testing. Basically, did it pass the mold, the pesticide testing? Were there metals, or was there too much water still in the product as it was sent to the store? So all those things we've had to kind of learn as research has come out as well, since it's still pretty minimal of what these health effects look like when patients smoke a product that has been contaminated or not produced in the correct way. So, and like I mentioned on the last slide, this has been especially important regarding outbreaks that we've had. So the Valley, the vaping outbreak in 2019 to 2020, we had that basically almost triggered our reasoning to why we needed this response. We also have seen, unfortunately, still, even with our legal regulated market, we see people consuming illicitly purchased products. We've had a few cases of children consuming Nerds Rope Delta 8 gummies that have fentanyl in them. Very concerning issues like that. And they're still prevalent even with the regulated market. But having this response is a way we can identify those cases almost immediately and identify where they came from. And then we also, especially in states that haven't legalized marijuana yet, we saw the influx of Delta 8 THC products. So this was that loophole in the hemp bill that allowed concentrated amounts of Delta 8 THC to be manufactured from hemp-derived CBD. So at first, it's technically not psychoactive, but then they use chemicals basically to make the Delta 8 essentially the same as Delta 9. You just have to consume a little bit more to get the same effects. But we have seen a lot of problems with these products as they're not regulated. They're sold in anywhere you really can think of, gas stations, online, Craigslist, things like that. So having this adverse health event response has been really instrumental to tackling that Delta 8 issue as well. All right, so just in conclusion, after we legalized, we came up with this systematic, unbiased approach to review current scientific literature. Especially as these years pass, we've seen such a big influx of marijuana research that it's sometimes monumental just to try and stay on top of it and to inform, especially health providers throughout the state of Colorado, what the current research is showing. We have continued surveillance of epidemiologic data, and thankfully will continue to for the foreseeable future, as this has been ways we've identified issues and things to focus on. And then just in the last slide, our adverse health event response procedure has been developed. And then just to leave you with some challenges, which I definitely know I focused on throughout the presentation, but those unintentional exposures among children, especially related to edible products. Youth dabbing, the high THC concentrate use is a big issue. especially with regards to how it might impact their health as they age and get older. And then, of course, use during pregnancy and or breastfeeding, as more evidence comes out to show that it might not be as safe as some mothers thought it was in the past, or maybe it isn't as innocent as people think to use during breastfeeding as well. So thank you. I know I saw some questions in the chat.
Yeah, we got a few, and I'll just start running through them. And if people want to unmute and ask their own questions, I think that's fine as well. Just chime in. First question is, when you look at the youth use, because they can't go legally buy it, what percentage of the youth are buying it illicitly? Any clue on that?
No, unfortunately, we do not collect the data. We just last year, we implemented a question of asking where they got it from. So we'll have our first year of that coming up this year. But I'm very interested to see as well, because we do get reports, and it's especially a concern with our medical marijuana. One 18-year-old gets a medical card and then buys unlimited amounts of products and sells it to their friends. So we've got that of concern. And then, of course, the illicit market's always concerning. So we're excited to finally see where that's coming from.
We had another question come in. Beth, do you want to ask your technical question?
Well, I guess it was just the Delta 8. I had a few questions about that, and maybe I need to contact you directly.
Sure.
So Delta 8 being part of the plant, but being in such low concentration, that now a lot of it, and just please jump in and just correct me, but such low concentration that now a lot of it is manufactured as opposed to adding other, you know what I mean? Does that make sense? I just want to clarify
Absolutely. that. Yeah, that's exactly what we've seen with the Delta 8. It's almost chemically manipulated to be artificially stronger.
And I hadn't actually heard to be stronger. And that's what I'm, I guess, a little confused about, not doubting what you're saying, but if you have any additional information to share with that. And because I feel like Delta 8, the clinical effects are hard, not to describe, but to say what the differences are. That right. It seems to be less predictable.
Mm-hmm.
And what I heard anecdotally was maybe more paranoia, but I wasn't aware in terms of the potency.
Right. Yeah. And it's all unfortunately anecdotal evidence I have that I'm speaking on right now, but I have heard a lot of people have to consume a lot more Delta 8 to get those psychoactive effects that they usually desire and want from the Delta 9. So that's where my concern comes in. If they're using a lot more, what are the health effects associated with that? And it's just not well studied, unfortunately. Of course.
No, Richard, there had been a lot of talk, and I've seen other speakers from Colorado over the years at different conferences about the initial thought was that alcohol use would go down when there was legalization of marijuana. And in fact, it went up and is still 3% higher than it was. Can you just talk to that a little bit?
Yeah, it's definitely interesting that essentially marijuana was sold as something that would reduce alcohol use, when we're finding now from our perceptions of use and reasons for use in our surveys that people aren't using for the same reason they're using alcohol. So there's not really that overlap that we were expecting to see. It's not, marijuana really isn't used very commonly as a party drug. Like alcohol, people are using it more in social situations and going out to bars and things like that. Whereas marijuana, especially in the state, we've been trying to push it as more of a medical product, essentially, just trying to focus on that reasoning. And honestly, that's maybe what I think, why it's surprising that we saw an increase in alcohol use after. But yeah, I would love to collaborate with our alcohol department on a paper on that and see if they have some theories and more insight too, because I know they collect a lot of data as well.
Yeah.
So with that, did you see any changes in like motor vehicle accidents related, because along that same lines, they thought alcohol would go down. Do you differentiate or separate out the motor vehicle accidents that have just cannabis combination with alcohol or just alcohol and how that's changed over time?
Yeah, so unfortunately, the data for that is with another department, and I don't want to quote them wrong, unfortunately, but I do know the science shows that combined use of alcohol and marijuana has led to an increase in crashes and road vehicle accidents or things like that. Regarding just marijuana use, I think that's still a very touchy subject, as there isn't a good way to measure it. I actually just published a paper recently about how to detect acute marijuana use versus those chronic users. But I know I'm pretty sure the statistics did increase after legalization, but then have remained steady since then, which is obviously unfortunate because we want to see a decrease. But
Dana, did you want to ask your question? You have to unmute.
Several questions, and I'll follow up with you offline, Richard.
Absolutely.
I'm with the health department, and we're charged with youth education with no additional staffing. So I've got a
Sounds
variety
familiar.
of questions related to that. I think one of the things is sort of, and we'll ask, because some of it is like, what's, as far as perception of risk, is that just left up to the respondent, or is there are some examples of that? Because I think you're right about tailoring the messages. There are different risks, I think, for different age groups and different populations. That's one thing I'll follow up with you. The other thing is with the perception of driving. I remember a study in California had done, I think, roadside stopping people, and I think 20 to 30% of the people that were stopped thought they drove better after driving. And I don't know if you did any of those questions or those perceptions. Again, I think it's about addressing some of the risks that people have and misperceptions. So we'll have some follow-up discussions. Thank you. I look forward to contacting you and having more discussion. Thank you.
Yeah, absolutely. Thanks for that. Yeah, and just to answer your first question, the risk perception for youth is like a multi-choice answer. So it basically just a high risk, moderate risk, low risk kind of question.
So not sort of psychological or mental health ways,
Right.
or
it's just
some
very
things.
broad.
Yep,
unfortunately, yeah. As time goes on, we have we get a little bit more funding, so we can ask a couple more questions. So that's kind of how we've been focusing this, and I think that will be our perceptions question wasn't added until I think maybe 3 or 4 years ago at this point. So I expect to see more questions like that we can add.
I think the other thing, as Dr. Bilden was raising, and about with women who are pregnant, part of it is what's, I'll ask you then offline, is what's sort of the legislative or legal environment. Sometimes there's legal environments that encourage or discourage women for seeking help, and I think that might be another part to see what Colorado has learned or not learned.
Right. Yeah, definitely agree with that.
I want to piggyback on that, and then on both of those points, actually. Just to finish with the pregnancy thing,
Sure.
Just simple. Is Colorado a mandated reporting state? Just because Minnesota just changed ours, and just with that perception, and with pregnancy and what Dana was just saying. And then second, and any of those youth questionnaires, were there ever like open spaces, where you talked about youth is starting to see it as more, higher risk or whatever? Any kind of like free comments that you've made? I would just be really curious to hear in their words how their use has changed and why. Like, what has been the most effective strategy for them versus a bunch of adults thinking that this is effective?
Exactly. Yeah. And I know for a fact they did do open surveys, more focused surveys, when they were coming up with the Responsibility Grows Here campaign. They did go around to different schools and went to different areas too, made sure they were in rural and urban areas to see how those youth perceived marijuana use before development of that campaign. I don't know if our Healthy Kids survey has an open-ended question. Unfortunately, I'm not the data analyst, so I don't see the raw data. I just see essentially what they then put up on our website, which I I'll put the link in here again. We have all our data pages on there that have a lot of dashboards that you can click around and look at all that. But I think we would like an open-ended question. It's just how do you then use that information when you don't have like a specific research project or something going on, like developing a campaign. That's our issue. We're a team of 3 people here, unfortunately. So it's kind of like we have to pick and choose what we want to focus on, and yeah, but that's definitely something we're looking into pretty much all the time. Honestly, is how can we improve our questions and get more out of it.
So yeah,
and,
Beth, do you want to go ahead and ask your question, Beth?
The most recent one?
Yep. Go ahead.
See, I'm wondering, I think the request would be if you could forward the paper that you just talked about that you've done, and it sounded like testing in the setting of chronic use and determining that. I struggle a little bit with which metabolite, and for confirmatory testing, I'm specifically asking about urine and again, confirmation. So how do we tell? And the stuff that I had or read is, Hustis, but it's old. I'm not sure she's retired, but still working, I think. And the bottom line is, what metabolites are we looking for? And how do you know that? Again, getting to know your lab, where you work, first of all, I get that when we're just doing immunoassays, but what metabolite do you think we're looking for in the setting of chronic use to say that it's chronic use?
Right. Yeah. And that's exactly the issue is how do you measure that? And especially on the roadside when it comes to car crashes, there's no way really what are you going to do, a blood test on the side of the road? And even that only shows acute use, that has some of the chronic metabolite there, as it's broken down. THC is stored in the fat, then broken down. And that's how you measure the chronic use, is by that metabolite. I think it's the 11-hydroxy THC, I think it's called. But it's so early, unfortunately, that we're basically right now, we're just continually recommending these research projects to be done and to be developed so we can monitor. And we did have one recently that came out that was looking specifically at breast milk and seeing which metabolites were in that. And they did find that there was even active THC in breast milk being passed through to the infant. At what levels, it was wildly different from person to person. So I think there's a lot going into how THC is broken down by every individual's body. And then not only that, but then passed on to your infant. That differs from mother to mother as well. So yeah, it's unfortunate we don't have more information before it was legalized, but thankfully legalizing has brought attention to a lot of our areas of concern and pushed research like crazy. So we're getting there with this information.
Well, thank you. And thanks for the great talk.
Yeah. And of course, anybody can definitely email me. I'll be happy to send more extensive explanations and references as well, just to help support, the research evidence-based things that you guys are coming up with.
To be respectful of your time, we'll have 2 more questions. Christine had a question, and Dr. Bell has one final question. Christine Bell said, I would love to know if the dip in use during COVID was actually due to less pressure on the teens being at home versus being at school. Thoughts on that? Yeah,
we actually have hopefully a research project coming that looks at the behavioral aspects of why adolescent and youth choose to vape. And it includes nicotine and cannabis. So I think that's going to answer a lot of that question, because obviously right now it's all preliminary. It's all our theories and hypotheses about why the data dropped. It might be actually a good thing that's shown that our education is working and that youth are using less. Maybe it wasn't COVID, but unfortunately we've got to kind of take that view and expect it to be not as positive as we want.
Okay, so final question, but also, are you willing to put your email? Just type it into the chat as well.
Sure.
I think it'd be
Yeah.
helpful. So really quick final question is, was it worth it? Like, do you, for you to do the research and all of that, you know, I know it was all about let's make money Colorado, and you see the data and all this, like from your perspective, I'm not going to have you speak for the whole state, but from your perspective, was this a good idea?
I do think so. Just based, if you want to simplify it to the fact that we can have rules and regulation about what people are consuming, I think simply down to that, it was worth it. Just minimizing the risks. You know, people are going to use cannabis no matter what. We'd rather them get it from somewhere we know was grown in a nice environment, doesn't have pesticides, mold growing on it. So as far as that, from that perspective, I absolutely think so. I think it also is good that it kind of exposed these problem areas with cannabis. I think if you never legalized, you wouldn't get down to this point and know what the actual issues are, because it's just then an illegal drug that's demonized, essentially. So now we can at least look at it closely.
I think that's a spectacular answer. I appreciate
Thank
it.
you. Yeah, of course. Yeah, thank you, everybody, for your questions. I'll try and look through the chat, too. I think, did everybody get to ask? The ones in the chat, too? Or
I think most all of them were answered. I don't know if you noticed anywhere that weren't.
The one question I noticed, and I don't know if Charlie's still on, is did you happen to know in the pregnancy one if which trimester seemed to be most correlated?
Yeah, unfortunately, I don't really want to answer that because the scientific research doesn't really know either. In my head, I like to think that the first trimester, just based on my medical experience, that's the most impactful usually for exposures to any type of product or anything. But I can see absolutely, exposure in the third trimesters maybe impacts more of the behavioral and developmental stuff, whereas early impacts may slow the child's growth, things like that. But use later might affect their brain development. So that's kind of my theory, but don't quote me on that because I haven't done the research. So,
all right. Well, go ahead, Beth.
Just a fentanyl question.
Oh, yes.
Because I just am eager to know and haven't been able to confirm, other than what the DEA has said, that it would be, I don't want to say surprising, but unusual. They have one report of fentanyl being found in THC product. So I'm setting aside what the tests in human samples show, but just the product itself. But we're anecdotally hearing the description of fentanyl was in marijuana. Has that been confirmed in Colorado to your knowledge? Just because I think you might be at the table where that might have come up with regard to risk, but.
Yeah, so we've actually only seen one case in Colorado with that. And it was the one I briefly mentioned it. A child brought a nerd's rope to school and shared it with a friend, bought from a gas station down in rural Colorado, and both were exposed to fentanyl. But that's the only case we've seen received a report of here.
And the nerd's rope is what was tested?
So, yeah, it's a commercial candy product. That it was advertised as a Delta 8 product, but the child actually went to the hospital after consuming it, and then it was determined at the hospital that it had fentanyl, and then the child tested positive for fentanyl in their system.
So that's actually what I'm asking, is not human, that a co-exposure. Do you know what I mean?
Right, like the product you're saying.
Yeah, I'm still struggling a little bit to,
we didn't get the product to test it at a state lab, unfortunately. So we were never actually able to recover it to test. But yeah, I would have loved to have gotten that information.
Okay.
Just to see. Yeah.
All right. Any other questions? Otherwise, we will let Richard go.
All right.
Well, Richard, really, I think we both thank you for this talk. We may come back to you next year and see what happened with this next stuff coming out, because this is certainly something we're looking, what's going to happen here. Is this legalized? And how are we going to, what kind of things are we going to see? So thank you so much.
Yeah, absolutely. I'm always happy to share our lessons learned so you guys don't have to do the same thing.
That's huge.
Yeah. All right. Yeah. And feel free, anybody contact me via email. I appreciate it. Thank you again.